Once upon a time, when pain is more manageable, when pain is more tolerable, until it becomes unmanageable, it becomes intolerable. Introducing Dr. Luna Labred, a pharmacist works at the Luna Labred Pharmacy. And here is Sue, a mother of two. She is recently diagnosed with arthritis. She complains of pain and needs treatment. However, she is extremely skeptical of both Western and Eastern medicines. Let's see if Dr. Labred can help her.
Well, she can help me actually. I'm 67. I'm in pretty good shape, I think.
Okay.
And I don't think there's anything you can offer me that I haven't tried before.
Okay, well, you never know. I do have a few treatments that you may have not considered.
You gonna make me take medicine?
No. Sometimes I don't think that medications are the right or the best solution. There are usually some alternatives sometimes that you can use that could supplement the medicine and may be able to help you. Can you tell me about your knee pain or what kind of pain that you're feeling?
Well, my knees and my right hip are starting to act up, and even though I don't want to admit it, it really is starting to help me. Sometimes I should take some medication, just to make the pain go away.
Okay. Well, what kind of medications are you taking?
Well, I was trying Tylenol for a while, and I used Motrin. It helped a little bit, but it's still, hard to get around the house. I have some stomach trouble too, so that doesn't help.
Oh, no. Well, did the Tylenol help you at all?
No, not really. It didn't help at all.
But other than your knees and hips, do you have any other health conditions?
No, I'm in pretty good shape.
Oh, that's good. When did you last see your doctor about your condition?
I saw her a month ago, but another doctor told me a long time ago that I was arthritis, and it's pretty painful.
Okay, and then you also said that the Motrin caused stomach pain.
Yeah.
Has that happened before in the past?
Yeah, I had some bleeding once. I don't remember what it was. Was it my stomach or intestine? Somewhere like that.
Oh, really?
I really can't remember.
Well, listen, if you're up for it or if you're willing to, I do strongly recommend alternative treatment. And that's because like the Tylenol and Motrin didn't help, and then you have some history of stomach issues and alcohol use, so
alternative? What does that mean? I have to take more medicine?
No, but for example, there's this alternative treatment called acupuncture. Have you heard of that before?
These sticking needles in the body?
Well, it is an ancient Asian practice, and it's been used for over 1,000 years, even long before a lot of medications that we take now. And recently, even Western medicine has been doing a lot of research in it, and they're starting to find efficacy in its use. And it's used a lot to treat your condition, your specific areas of pain. Usually people go and see acupuncturists when traditional over-the-counter medications don't work, or their doctor really can't find something to help them.
I really don't like the idea of being experimented upon. I don't like the idea of needles, It doesn't sound too good to me.
I know it's a little scary and it's not 100% conclusive, but if you're willing to give it a try, you never know. I personally am scared of needles too, but I have tried acupuncture and it actually did help and it did relieve some of my pain, and everybody's different, but I can't guarantee you that it is going to relieve the pain, but it's, it doesn't hurt to try it.
Patients can present similar symptoms, but the root causes can be dissimilar. Hence, like other alternative medicines, acupuncture treatment tends to be individualized and treatment response can be varied.
What if I get an infection? Are those needles clean? Do they?
Well, actually, so the needles, they come and they're sterile, they're individually packed, and they make sure they're sterile, and then when they use them on you, they throw them away, so they're not reused to save patients, so the risk of infection is really low.
Okay. Where do they go to school? Can anybody do it? Or?
Well, they have to go to 4 years of school, and they have to take a national exam, make sure they get certified and licensed. So they do have a lot of practice, and they also have to do, just like I had to in pharmacy school, they had to do rotations, and they had to make sure, they had to practice under a licensed acupuncturist, and make sure, that they could perform their skills.
Would my insurance cover it? I'm sure it must be expensive.
That is a true point. It is expensive. Some insurances cover it, some don't. But I can provide you with a list, and we can start from the top and just find whichever one or whichever select few are covered by your insurance.
What about, is there anything else besides the needles that I could try?
I don't know if you've tried these before, but there are some topical products. There's there's icy hot, if you've heard of that. Or there's arthritis, some other arthritis medications that you can use. They're similar to icy hot. It has an active ingredient. Most of them have an active ingredient called capsaicin. And you just rub it into the area of pain, and it gives you temporary pain relief. But it's not, the thing with those, it's not a permanent fix. It's just temporary.
Okay, I think I would be willing to try those. Anything to make the pain go away, even for a little bit, that should be good.
That's great. And there's also, even with acupuncture, there's also other, I don't know if you do a lot of exercises, but there's something called Tai Chi. And that's got a lot of movements that kind of help your joints and things. And we can also do scans on you just to look at your joints more closely, or have the doctors do scans on you. I don't know, has the doctor done scans on you already?
Well, I'm not sure about the doctor thing, but you've given me a lot of other good things to think about, so let's think about those for a while. Thanks.
Okay, you're welcome.
Cool. All right. Thanks, Luna, for talking to me. Appreciate it. Oh, yeah, you're welcome. Anytime.
Very nice to meet you. Let me know
Yeah,
if the acupuncture helps you. If not, please come back and see me. We'll find some other alternative treatment or some way to help you.
Thank you.
I look forward to seeing you and hearing an update.
Thank you so
All
much,
right.
Luna.
All right, take care.
All right.
Bye.
Let's go, Mom. Yeah.
Okay, so I am here right now with Mr. John Norkus and Miss Emily Johnson, and we're just going to talk a little bit for a minute about alternative medication. Say you had some joint pain. How would you feel about if I, as a pharmacist, recommended acupuncture?
I'd look into it.
Yeah?
I'm not afraid of it. If you need it, you need it.
Okay, okay. And what about types of movement, for example, something like Tai Chi?
Well, I don't do it. The main reason I don't do it, I don't think it's active enough. If you really insisted I would do it, I'd do it.
Okay. What about things like using herbs or traditional Chinese type medicine?
There again, if I needed them, I would look into
Okay.
them. I don't need
So if your pharmacist, in summary, if your pharmacist were to recommend something to you, what do you think, would you...
I'd look at it. I wouldn't turn anything down. Because to me, the pharmacist is my key. The doctors are you only get to see in 10 minutes, and you don't have a chance to talk to them. So between the nurses and the pharmacist, that's it. Because as I said, I went through a long illness with my wife, so I know that's who my friends were, pharmacists and the nurses. The doctor come in, run out.
And now, Miss Emily.
Yes.
So if I, as a pharmacist, you say you're experiencing some joint pain, how would you feel if I said, why don't you try some acupuncture?
I would consider it, and if I felt bad enough, I'm sure I'd be willing to try. Because I know medicine doesn't take care of everything.
Right. What do you...
Actually, medicine, the acupuncture wouldn't affect your insides as much as medicine would be. It actually affects the pain where it is, and you don't get into other things.
Well, what about, so with this acupuncture, would there be any kind of questions you'd want to ask, or what kind of concerns do you think you'd have, or reservations maybe?
Well, I would expect that hurt some.
Mhm.
I'm not sure how much, but I would expect it
What
to
about
hurt
if
some.
you heard something like Tai Chi? Do you know anything about Tai Chi, or
No, I really don't.
what about herbal medicines and things like that? How do you feel about those?
Well, I would be willing to try. Because I know that years ago people didn't have all the medications that are available today, and they found ways to help some of the problems. So that would be a possibility.
The biggest thing is that don't, in your mind, make fun of them. I don't know how you can put that. Take them seriously, even if they don't sound like they're all there. Try to figure out what they're trying to say, because I've seen people stumble when they get near a pharmacist because they're scared.
Sure.
And the doctor the same way. Listen and take your time listening to them. And it might take a little longer for them to tell you something, but listen to them.
Okay, that's great advice. Thank you. And Miss Emily, do you have any words of wisdom for pharmacists trying to help people? And
Well, I think I told you before that I relied on the pharmacist for the interaction of medication, because there's a lot of medicines that don't interact very well, and you need to be aware of that before you take some new medication.
good. That's good. Thank you.
Acupuncture treatments have been used extensively in Eastern medicines, even though concrete evidence has not been fully established through scientific methods. Its use could be employed depending on patients' consents and conditions. This statement is not meant to promote acupuncture as a cure for any conditions. Please seek professional help before trying any alternative methods. And thank you for watching.